இருக்கிறாரு.
எங்கே இருக்காரு?
லைன்ல இருந்தாரு.
வந்து மறுபடியும் போயிட்டாரு. இப்போ யூ கேன் வெல்கம் அண்ட் ஸ்டார்ட் லெக்சர்.
ஓகே சார்.
அவர் அப்புறமா அவர் எடுத்துக்குவார்.
Good evening, everybody. I am welcoming all for our today's program. Today, like in continuation with the virus discussions which I have done last week, I'll be refreshing our memories on the viral infections which is going on these days, which is having the flu and a similar type of diseases. So just we will go through the slide. Yeah. So this is H3N2 virus flu. That is the common flu. It's called swine flu also. That is the common flu what we see these days. And along with that, I will be discussing chronic obstructive pulmonary disease, which is called COPD. Okay. The influenza A virus. It's a variant virus of H3N2 virus. The influenza virus is normally, this influenza virus specifically is seen in pigs. And people who handle the pigs also have got infected with this virus, and that's called swine flu. The influenza A H3N2 variant virus with the matrix M gene from 2009 H1N1 pandemic virus. So it was a variant of H1N1 pandemic virus. The virus which has become like SARS virus, which we all remember a long time back, was detected in human beings in 2011. The virus first identified in pig in the US in 2010, and during 2011, 12 human beings got infected with the H3N2 virus. During 2012, multiple outbreaks of H3N2 virus were resulted, and more than 309 reported cases were there. Now there's like recently nowadays those days there was a quick rise in the infection with human, because human to human infection is easy. And India also had a lot of infections, and in Karnataka and Haryana there were 2 deaths also. Further, 90 or odd cases were reported across the country. The sporadic infection with H3N2 virus have continued to be detected since that time. So after that, there was a lot of infection with H3N2 virus. Infection of the H3N2 virus mostly is associated with prolonged exposure to pigs and agriculture farms. So people who have raised pigs in their farms, and they get exposed to the direct contact with the pigs, they are the people who are susceptible to get this infection. This human to human spreads through like a droplet infection similar to the COVID what we were discussing, and this localized outbreaks continue so that the virus is always circulated within the human society. The Centers of Disease Control and Prevention continues to monitor the situation closely and are reporting cases of H3N2 and its variant influenza viruses. They keep reporting weekly. So symptoms of H3N2 viral infections. According to many doctors and researchers, severe H3N2 symptoms last only for 3 days, but coughing problem will continue, and it takes a more time, more than 2 weeks to completely fade out. So we all know, like we get cough after cold, and it takes a long time. So maybe this is the virus, and this infection visible effect will vanish off in 3 days, but the cough remains. According to National Center of Disease Control, currently most of the cases of fever, fatigue, cold, cough, headache, muscle ache, sore throat, nasal congestion are due to the influenza virus, and it's expressed by different people differently depending upon the immune system. Most of the H3N2 viral patients shows symptoms of fever. Fever is as we discussed earlier, fever is not a disease, it's a disease expression, and the the body is trying to fight the foreign organism which is invaded in our body. Nowadays, all respiratory infections are due to this influenza virus and the variant. So we have COVID infection on one side, and we have this H3N2 on the other side. So this viral infection is only going through this cold times. Coughing is another H3N2 symptom. Coughing will be continuous. It will show in the early part of the infection, and it will last, even though the infection fades off in 3-4 days, the coughing will take a long time to leave our system. The patients will definitely feel fatigued when they are infected with H3N2 virus. Fatigue means we will feel weak and tired. It blocks the mind from feeling better, so the patients don't recover from the illness. So they feel totally tired. Even though the infection is gone, they'll have the tiredness, which is, they say, like after the infection, the tiredness have not gone. So that is the symptom of this H3N2 virus. When all other symptoms of this fast spreading disease troubles the patient, his brain starts having fatigue. So when generally when every other the visible symptoms are gone, the brain will be tired. Slowly the patient's muscles of the body will start to show pain. Specifically the muscle of the back and legs, there will be backache and leg pains will be there. So that is another symptom. All H3N2 infected patients also say that they have throat ache, throat pain. For this symptom, warm salt water gargling, the traditional treatment what all of our home remedies we do, no? Warm water gargling can give some relief. If there are problems of nasal block, or feel a raw sensation in the nasal cavity, then steam inhalation with freshwater steam will help. So these are the common things. There is nothing much to do with this. The saltwater gargling and steam inhalation will relieve the symptoms. Even though it will go in 3 days, we can feel better by doing all those things. How a person get infected with H3N2 virus? We have already told it is initially swine flu viruses got into people's body through contact with infected pigs. People who keep pigs in the farm and houses are getting infected with H3N2 virus. Though through droplets created in the air when the pigs cough or sneeze. Pigs also sneeze and cough when we have seen cows sneezing, goats sneezing, or dogs sneezing. So even the pigs also will sneeze, and they will release their saliva, their droplets. The mucuses will fly in the air like the same droplet infections we were scared of when we had COVID. So human inhale the same and get infected, inhale the same infected air by the pigs, and the influenza virus enters our body through the other openings, like in outer openings, so that like the mouth, nose, even sweat pores are like if it falls on our skin, the skin has a lot of holes called sweat pores. It will enter through the sweat pores also, and through the eyes or ears, everywhere the infection can enter. So this is a little tricky. The person can also get infected with the virus coming into contact with already infected H3N2 virus infected persons, like person-to-person infection also is possible. So some of the important remedies which we normally give for this thing, it is Gelsemium. Gelsemium is one of the top remedies for swine flu with dullness, drowsiness and weakness. It is prescribed when there is a runny nose, which is bland, and sneezing is accompanied by pain in the eyes and head. So Gelsemium, when the pain is the eyes and head, patients also experience weakness and drowsiness. There is a frequent violent chilliness up and down the back. So backside we will feel that it is cold and chilly. Face is flushed and dark red. So there will be red blood rushing in the face. So face will look dark and red. There is muscular soreness and headache. No thirst is there. Another keynote symptom is with trembling. So there will be cold, chill will be there, trembling will be there. The patient wants to be held because he feels shaky. So the patient wants somebody to hold him together, so that he will be shivering and trembling and shaky because of this. So Gelsemium will help in such cases. Then Epitorium puff, which we all use for all the fevers, is a good remedy for this swine flu. It's severe deep bone pains. which is relieved by pressure and movement. So when the pains are better by pressure and by moving, the Pitorium perf is the best medicine. The Pitorium perf is indicated for fever with chill followed by vomiting of bile. Sometimes they will be vomiting of bile. So Pitorium perf is the right medicine. Chill proceeds by thirst and great soreness and aching of bones. Severe shivering runs down the back and spreads to the extremities. From the back, it will go to the legs and hands. And the patient is also having coryza with sneezing, hoarseness, and loose cough will be there. Patient feel dryness of the body. So Epitorium perf is another medicine indicated for swine flu. Bryonia is another indicated remedy for flu, which is complicated with pneumonia. Pneumonia, lungs infection also will be there. There is stitching, tearing and shooting pains in the muscles, which is aggravated by least movements. Dry hacking cough, causing much pain in the lungs and chest will be there. Dry mouth with thirst of large quantities of cold water and bitter taste in the mouth will remain. So these are the symptoms of bryonia. Severe bursting, splitting type of headache also will be there, and much sweating of the body also occurs. So these are the symptoms of bryonia. Arsenicum album is one of the excellent remedies for swine flu with the thin watery discharge from the nose. The discharge leads to burning sensation and most of the times it is accompanied by sneezing. Person's condition gets worse in cold air. Being in warm room can provide some relief to the patients. Another striking symptom are great restlessness will be there with complete exhaustion and thirst of small quantities of water in short intervals, not like bryonia, large quantities. Small quantities of sip of water will be taken in short intervals. Rustox is another effective remedy for swine flu and is with constant chillness as if cold water is poured over the body or as blood ran cold through the veins. There is much aching pains in the limbs which is aggravated by rest, better from movements. Another prescribing symptom are the restlessness, because restlessness is there and movement will be making it feel better. So the patient tosses about in the bed to give him relief. Tongue is dry with triangular tip. There is hard tickling cough. So these are the remedies, the symptoms of the remedy Rustox. Dulcamara is one of the best remedy in the acute form. There is sudden worsening of this situations. Dulcamara. It is brought on by wet or change to cold weather. So some hot rooms suddenly to cold room will give the severity of the the fever to increase. The other symptoms are the eyes will be stuffed and throat will be sore. So cough hurts due to muscular soreness. So Dulcamara, normally the change of weather we give Dulcamara. Change of rooms or the temperature changes is giving this acute symptoms. So Dulcamara will help. So Baptisia is another medicine. Baptisia, which we use for other fevers, effective for swine flu also. Is marked gastrointestinal symptoms. Unrelenting flu. The flu will not subside. It will be continuously having flu in type of fevers. Blurry eyes, aching head and sore throat, pains and soreness all over the body, and profound prostration. Stupid look and stupor from which is difficult to arouse the patient. So patient will be dull, having dull look and stupid look, and he'll be always trying to stoop down and lie down. So Baptisia will be such a thing, and gastric symptoms will be there. Causticum is very effective when there is high fever and flushed face, no chilliness, much prostration, could hardly get out of the bed. Nose will be stopped, coryza free and watery. So hoarseness will be there. Dry hacking cough which is persistent. So causticum. So this is another medicine called oscillococcinum. It is another name is called Anabarbierae. It is an nosode, a single dose pill of 200 potency will relieve shortness and duration, and shortens the duration of the symptoms such as fevers, chillness, body aches and flu. It is useful in preventing seasonal colds and inflammation. It is like a vaccination, a preventive, we can take it. Inflammation of the airways. It helps to reduce and the feeling of fatigue and treating fevers. Studies show that medicine is effective for swine flu. It can also be used for prevention of swine flu. So we can use it as a prophylaxis to this thing. It's an ozone. And prevention will be, we can use for prevention, influenzinum 200, oscillococcinum will be there. Merxol are considered to be the Merxol in higher potency. One is considered like 10x, is 1000x is considered as the prophylactics or preventive medicines. Wearing face masks during like what we did during COVID and going through crowded places also will avoid us from getting these infections. So this is about the swine flu, and now we'll talk about the chronic obstructive pulmonary disease, CPOD. It's a chronic inflammatory lung disease that causes obstructed airflow from the lungs. And symptoms include breathing difficulty, cough with mucus, and mucus production will be high, and wheezing. It is typically caused by long-term exposure to irritating gases or particulate matter. Like in Delhi and all, we have this particulate matter of smoke and everything flowing always. And even our this bogey days today, we have all these smoke everything early morning. So most of like even smoking also can get this issue if you are continuously exposed to this. People with CPOD are at higher increased risk of developing heart disease, lung cancer, and variety of other conditions. So that is CPOD. And human rhinovirus, respiratory syncytial virus, RSV, and influenza are the most commonly detected virus during these disease aggravations. The role of persistent viral infections, that is adenovirus, has also been considered as a potential pathogenic mechanism for CPOD. So this adenovirus infection will remain always, and that can be the cause of CPOD and other common viral infection, including this the flu influenza virus also can lead to CPOD. The most CPOD flare-ups are triggered by upper respiratory infections like common cold and flu. So in most, it is important to know that more about CPOD. It is important to know more about CPOD and its management, as there's an outbreak of this H1, H3, and N2 viral flu, which is we have seen, and when the cold times started, everybody started getting nasal infections and cold and all. So it's better to know much about CPOD. CPOD, yes. Chronic obstructive pulmonary disease. This is a group of progressive lung disease which includes emphysema, chronic bronchitis, and emphysema is a degenerative disease of the alveoli, and bronchitis is the inflammation of the bronchial tubes. The total cure, once damage is not possible in any system, we can stop further damage by using some of our homeopathic remedies, which we can discuss here. Symptoms of COPD is often don't appear until the significant lung damage that has occurred. So when there is initial symptoms, it's better to contain it than allowing it to settle on its own. So once it has started damaging the lungs only, we will know that there is CPOD, and this usually worsens over time, particularly if smoking or exposure to polluted air continues. So people in Delhi and all have to be very careful about these other things. And sign and symptoms of COPD include shortness of breath, especially during physical activities. When you strain yourselves or climb stairs or walk a little faster, if you have shortness of breath, then there is a problem. Wheezing will be there, and you'll feel tightness of chest. A chronic cough that may produce mucus that may be clear, white, yellow, or greenish. That is one of the symptoms. Frequent respiratory infections, lack of energy, unintended weight loss. There is unintended weight loss. So without reason, you will be losing weight. Then swelling in the ankles and feet or legs will be there. Then people with COPD are also likely to experience episodes called exacerbations, that is disease aggravations, during which their symptoms become worse than the usual day-to-day variations and persist for at least several days. So they will be suddenly sick, and the sickness will not go immediately. Tired and worse, this symptoms will remain for several days. we have selected a few homeopathic remedies, well selected remedies which are effective for COPD and can manage safely without any side effects. So one is the Aspidosperma Q mother tincture. Aspidosperma is one of the best remedies for COPD and is considered as a tonic for lungs. Aspidosperma removes temporary obstructions to the oxidation of blood by stimulating respiratory centers. Another guiding symptom is want of breath during exertion. So when you feel breathless when you are exerting, Aspidosperma is the best medicine and it works very well. Antimonium tartaricum 30. Antimonium tart is the best for COPD, where emphysema of the aged people, coughing and gasping will be consequently there, and there is great rattling of mucus in the lungs and rapid, short, difficult breath. So antimonium chloride is for rattling cough, and that works here well. Bryonia alba is another excellent remedy and is prescribed when there is frequent desire to take long breaths, must expand the lungs. So lungs normally suddenly we take deep breaths, so this will be frequent deep breath. And there is dry barking cough, worse at night. Another feature is quick, difficult respiration and pain in the chest. So they will be trying to breathe faster and there will be chest pain. So bryonia. Coca 30 is a prescribed for COPD where there is want of breath or shortness of breath. Coca is especially used for aged sportsmen and alcoholics. There is hoarseness or loss of voice and dyspnea. Naphthalene 30 is prescribed when there is dyspnea and sighing respiration. Naphthalene is used for emphysema of age with asthma. There is long and continued paroxysms of cough and tenacious expirations. So there will be expectorations also, and emphysema for age and with asthma. Senega is another effective medicine remedy and is with increased respiration. There is excessive dyspnea and sharp contractive pains of the muscles of chest. Another feature of persistent cough. And lobelia is another prescribed for COPD medicine where there is coughing with vomiting. Asthma precedes by pricking all over. Hyperventilation, panting, threatened suffocation, fear of death, chest feels constricted and worse from movement. So lobelia is commonly used, so it's a very good medicine. Antimonium arsenicum is an excellent remedy with COPD, with emphysema. There is excessive dyspnea, cough with mucus recreation, worse on eating and lying down, asthma-like conditions. Then Chinonium ars is prescribed where there is asthma-like attack with which occur periodically with great prostration. Then Strychnium is respiration increased, excessive dyspnea, sharp contractive pains in muscles and of the chest, persistent cough. Then Curare is prescribed where there is threatened cessation of respiration on falling asleep. Like when you sleep, you feel respiration stops. So such people will require this. Other symptoms are short breath, short dry cough, chest is sore, very distressing dyspnea. Rumex is tickling in the throat pit. Initially, it is dry teasing cough followed by stringy cough while talking, watery, frothy expectorations, rawness in the larynx and trachea, pressure on the chest, soreness behind the sternum, left side and cold air aggravates. So this is Rumex. And Cardibicromicum, cough with yellow stringy mucus, worse in the morning. There are many more medicines which we can discuss, and it will all be given according to symptoms. So Kali Ide, Kali Carb, Carboveg, Lachesis, Hepasulf, Lycopodium, phosphorus, sulfur, spongia, selenium, stannum met, anacardium, cinna, ipecac, naja, cuprum ars, opium, silesia, and naxwam are a few which are usually used for COPD. That's all. there are now we have discussed the two conditions of respiratory issues, and I think within this cold times, all be aware of these conditions and go through this once again and make use of this good thing. Thank you. Thank you, sir. Surendra sir, you can take on, Surendra sir.
Okay. Good evening, everybody. I think all the elite members would have enjoyed the Bogi festival.
Yeah, they have Makara Sankranti
Also
and
wish
other
them
Lori and all.
Happy Pongal Sankranti. Okay.
Thank you.
Some two classes I have been telling you about cancer and its approach in homeopathic remedies. The very expression of or confirmation of cancer to the patient.
Bharani sir, your mic is on. Yeah.
Sir, to the
Gobind Bharani sir's mic was on, so I just asked him to close. You can,
Okay.
sir.
to the patient will reveal his mental disturbances, extreme death and anxiety, fear of occurrence of the cancer, worry about future, despair about the future, anger at being ill. He's very angry. Why I got this? Restlessness. Physical symptoms of cancer patients already under allopathic treatment gives them shortness of breath, complications of steroids, post-herpetic pains and syndrome, post-pain in the surgical parts, burning pain, intractable pain, etc. etc. See, there are many medicines in the homeopathy that acts before the cancer and even after the cancer, affection of cancer or confirmation of cancer. Supposing you have been disturbed with X-ray and the radium treatment. Radium bromide homeopathic medicine helps you. X-ray medicine, no salt, in the homeopathic potentized pills will help. Yes. Now, what are the general problems that a patient, because the patient comes to you after undergone chemotherapy and immunotherapy, etc., etc., etc. Many cancer drugs have been put into his body. So what happens? General exhaustion, sensation of weakness, profound asthenia, depression of melancholies, with loss of appetite, cancer before ulceration, when pain is principal symptom, straw-colored skin, sallow complexion, constant pain, burning pain, etc., etc. Hard and painful, irregular enlargement of breast, etc., etc. So, there are very innumerable number of medicine in homeopathy. The first and foremost is Even the pre-cancer stage arsenicum album is the best remedy. Mercury groups are the best remedies. Carbo animalis is the best remedy. Then comes iodine. The cadmium sulfur group medicine, namely cadmium sulfuricum, cadmium metallicum, cadmium iodatum, cadmium oxidatum. These four drugs are very, very important in the homeopathic for cancer treatment. Kali iodatum, calcarea fluor, conium, Phytolacca, Arteria rubinson, sepia, creosote, argentum nitricum, condorango, etc. are also place their respective parts in choosing the symptoms. Cadmium sulfur will have a side effects of radiation and chemotherapy that can be avoided, that is removed. One should remember the great weakness accompanied by strong cachexia, typical for advanced cancer stages. It acts mainly on gastrointestinal tract. Cadmium metallicum, violent in vomiting, together with cadmium oxidatum, is good antidote against aluminum poisoning, so pervasive in our society. Cadmium iodatum, like iodatum flavor, is a warm-blooded and active against cancer of all glands, neck, tonsil, thyroid, testicles, ovaries, etc. Cadmium oxatum, active in all the salts, cadmium salts, that has a great reviving action on intractable cancer cases. So this indicates when the patient has already been treated with steroids and chemotherapy, immunotherapy, etc., how to decongest the condition. You have to give not only the medicines that decongest or remove the causation due to treatment of cancer by allopathic drugs, simultaneously you also must suggest some homeopathic drugs indicated according to the symptom. In other words, while treating the patient, it has to be taken as weekly or 15 days therapy. Somebody, because the patient is not able to move to the doctor's house, somebody can, on behalf of the patient, approach the doctor, get the medicines. That is why I already said, if the homeopathic hospitals are established, we can easily treat such conditions because body changes according to the anti-cancerous allopathic drugs, removal of the anti-cancerous drugs, then induction of homeopathic drugs. So these are all the complicated systems that can definitely help the patient in the prognosis. All right. Creosote is a cancer of the cervix, vagina, bleeding of ulcerations, and etc. etc. Argentum nitricum is a useful cancer remedy for throat, stomach, uterus, specially indicated in the ovarian tumors. Condorango for cancer of eyelids, lips, esophagus, stomach, intestines, and anus. Cadmium, cadmium sulfate used for cancer of stomach between arsenicum and bryonia, and it's a good remedy for burning in the stomach, vomiting, etc. etc. That's how you treat the patient with anti-cancer drugs and prognosis of the cancerous remedies. See, phosphorus for hepatic and pancreatic cancer, graphitis for cancer of ulcers in the skin, orienthagolam, a very good remedy of cancer of the stomach, cecum, center of action for pylorus, that is for the internal organs. All right. Sir, you already said about this, all these things, how to treat anti-cancer's problems, and etc. etc. How about our assurance that you are getting better, you are getting relief by treatment of homeopathic medicine, whether both ways or only homeopathic drug for cancer, as the case may be, according to the prognosis and the conditions of the patient. See, these things are rapidly growing cancer will have a poorer prognosis than slow growing one. When treated homeopathically, although this type of cancer may respond better to conventional treatment, a painful, hard, fixed and ulcerating cancer is worse than when these conditions are not present. Sometimes rapidly growing cancer growth can be predicted by active miasm. A predominantly psoric cancer will be slow growing, while active psychotic will be creating a fast growing tumors. Cancer cases of the patients are to be observed periodically, regularly, by constant change of medicine. Not that every day you have to change, you have to give one medicine and another medicine for homeopathically symptomatized conditions. When the allopathic treatment aggravations are diluted, there will be a mixture of liquidity in the body. In other words, what I am trying to say is, you are neutralizing them. What happens? All the morbidities are in the body. They cannot be removed by magic. They have to be only given treatment. There, the symptoms change. When you first begin treatment, first week, second week, third week, like that, or 15 days as the case be according to the gravity of the cancerous condition, you will see changes, lot of changes, because morbidity is segregated, pushed out, thrown out. Then what happens? Then the earlier problems, symptoms disappear, only pure cancerous symptoms remain there. Here, the patient begins to give different expressions, that is symptoms, different conditions of his body. Then it becomes easy for you to go ahead. So this reminds us how when a patient from long allopathic treatment comes to the homeopathic field for the first time, the same process is being adopted here. But we must be meticulously careful, because we should not neither aggravate, neither complicate, lead to the most cumbersome conditions. The patient, more than the patient, the physician has to be very, 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 very careful. Yes. Then comes, there are medicines like sedum acri and sedum repens. This is there in the Boric Materia Medica, page 581. I'll come to you. 581. Is a very, very small indication. See, homeopathy doesn't think of cancer. Only the modern days they think of cancer. They have identified these disturbances in the body long back, 200 years back. Not only they make a lot of fuss about it. If homeopathy is given a chance, if the patient comes to homeopathy directly when he is indicated about the cancer symptoms or confirmed, he can definitely be cured effectively by a prudent homeopath, efficient homeopath. Sedum acri is a hemorrhoidal pain like those of anal fissures, constricting of the pains, works few hours after stool and fissures. Say, why are you indicating this? These are all the symptoms that you feel when the cancer infection, cancer virus is there, germs are there. Some may get this. And compare sedum acri with Mecum arena hemorrhoidal diathesis. Stopping here for a moment. Sir, you are telling about the evolvement of symptoms, suspecting cancer. No, the symptoms appear, disturbances come to the body when you are treated with that. If you don't go to the normal condition, that indicates either your medicine is chosen is not correct, or the patient symptoms expression is not correct, or both combination, you and the patient, halt themselves. because it's all proven medicine. Just like a Muni or Sadhu or Yogi indicates the medicine to you, herbal medicines, you take it and you're cured. That is like this Boric Materia Medica. There's no second opinion on that. Only knowing things. 1,000 pages, so many medicines, so many symptoms. See, you see 581 page, you read it, very small thing. How beautifully it goes and tackles. Also, sedum repens is prepared from sedum alpacete, a cancer-specific action on the abnormal organs on pain and loss of strength. Pain and loss of strength. Why I am specifically expressing all these things? Because you cannot carry, homeopathic cannot carry all the things in the brain except he is introduced into this system at 20 years, and after 40 to 50 years he becomes very, very prudent, learned homeopathy. You can easily tackle all these problems. Yes, there are many problems that one will be facing when the cancer affections are there. Sir, why you are repeatedly telling about cancer, cancer, cancer? You are also threatening us cancer, cancer. No. Everywhere the statistical indication indicates that cancer cells are growing in the body. People are susceptible to infection. That is why I am telling you, you must be careful. You must be careful in your habitat, behaviors, and your mental thoughts, etc. Yes. I can take you to 2 to 3 cancerous treatments given by the patient. That is, 37-year-old married man with 2 children by 2 different husbands, woman, Mrs. 37, woman, married 2 children by 200 different husbands. In 1924, the patient was told that she had tumors in the uterus. It cannot be interfered because at that time she had a pregnancy. A few months later, she became pregnant and delivered another boy. Now, she had been told by 2 different gynecologists that she had a big tumor in the uterus. One surgeon also has said operation is a must and that she should go to the operation preparations. The patient complains of drawing sensation deep in the lumbar region during the emotional excitement. The flow is red and plain blood. Then, whenever she touches the vagina, she feels traces of blood clots coming out. She cannot stand at least bit of noises. Aggravation by standing and after eating. Headache can come between periods. She found she is fond of bread but cannot eat it as it gives headache. Fond of salty food, fond of sweets, but this affects her head. Not thirsty, sleeps good, but unfresh in the morning. Even after sleep, he is not fresh. She has much gas in her abdomen. So, from her marriage, after 2 deliveries, everything has led to this so much of complication. That is why I am telling you about the cancer. That is why she has been treated for all the problems, but then nothing has vanished, only aggravated, and she has been suffering with all these problems. So what is the treatment? Patient was bleeding in the vagina, menstruation. Analysis. The patient is reacting well so far for treatment in the cancer. Next following 5 years later, no further complaint. What the medicines have been given, the physician has not revealed. Three weeks after her complaint, bleeding from the vagina ceased by treatment of the homeopathic drugs. Menstruation ended. Period was not painful. She did not feel weak during the periods. All these things were there earlier. Mentally lighter. Headache not coming severely nowadays. Does not notice heartbeat problems. No bad odor in the stools. Better control over her mental faculties. The patient reacting well so far. She is no more centered to feel better mentally, emotionally, physically. Using LM potencies, I will decrease the succession and other doses. Next, following up 5 years later, no further complaints. The period of treatment is from 15 days to 5 years. So this is how a patient has been treated. Now, let us think about these problems on the homeopathic medicine. The physician would have given it. Physician would have given it. Because of her problems in the vagina, Oriental golem, Sabina, and Arsenicum album, and carcinosin. 3x tablets are available. All those things would have, for stopping the bleeding and other things, we have got a very good medicine. Hydrastis canadensis. Hydrastis canadensis. See what all these things go and do. The cancer remedies that homeopathically that you give, first they will attack the aggravations by the allopathic drugs. They create a screen, not immediately after first dose. It will take some time. Then what happens? The allopathic drugs slowly dilute themselves, mix themselves, come out. Because you see, it is all, you cannot stop the blood flowing. You cannot stop the organ functioning. So, slowly it comes out. I'll give you an example. there's a metal. It is been full of oxidation. Silver colored, copper colored. You are shining them. Locally we apply tamarind paste, or nowadays you get all other paste. So you remove them slowly. How much time it will take? 1 month, 2 months. After all, it will not get rust at all, because you are daily taking care of. So the application has removed the morbidity. The application has avoided the already troubled waters. This is how the cancer. But we got a very, very beautiful relief in the homeopathically treated. Nowadays, Ayurveda Siddha also make a claim. Andhra Pradesh, Karnataka, Kerala, they assure that you come to us with your report. So one need not worry about the cancer at all. When once the allopathic treatment where they confirm you that you have got carcinosis germs, stop taking medicines there. Go to either homeopathy, Ayurveda, or Siddha. Sir, or can you say that? Yes, I am telling you this. Because I want the patient not to suffer with something. Okay, thank you very much for giving the opportunity. I think I have not bored you much.
No, sir. Thank you, sir. It was very wonderful. Murthy, sir.
Sir, Suresh Kumar, sir. Suresh Kumar. Sir, Surendra, sir, you have told page number 581.
Sir?
You have told page number 581. What is the drug?
Yes.
No, I am unable to hear.
Sir, Surendra, sir, you have muted yourself. You can open the mic.
Page number 581. Because four books are there, 4 books, different names are there. What is the name of the drug?
We will ask him, sir.
Okay, Suresh Kumar, sir, you can start.
Anup, is audible to everyone?
Yes, sir.
Yes, it's audible.
Because I am coming through new system, that's why I am to ensure that the link is properly established.
Yeah,
Okay.
it's working.
Audible.
Yeah.
Okay, fine. A very warm good evening to all group members, and let me wish you all a happy Pongi to everyone.
Happy Pongi,
And
sir.
advance happy Pongal to all the members. The last Sunday we were discussing about the posology, that is the doctrine of dosage we were discussing, and we said that this dosage, we talked about the homeopathic dose actually, what it involves, the parameters. Our homeopathic dose involves with potency, then quantity, the form, and the number of administration of the medicine. With this, we also saw the concept of the dose, homeopathic concept of the dose. I said in the first place, the dose related to the particular preparation of the medicine, where I gave example of the particular medicine, which it can be started with from mother tincture to 6 potency, 12 potency, 30 potency, and then we can go in higher and order. So it first is the preparation involves. In the second, the dosage refers to quantity in preparation, the form of preparation. I said like any medicine of any particular potency can be given in the form of a dilution, that 1 drop can be administered on the tongue, or the dilution can be poured into the globules, and from there the globules can be taken 3 or 4 or 5, whatever the physician decides, and or the pharmaceutical indications are given, and sometimes it is dispensed with purified water, that is distilled water, or the medicine is mixed with the sugar of milk and it is been administered. So it is the preparation and then the quantity and the form in which we are going to administer. That is also matters. And in the third place, the dose also involves the number of administration of the medicine. That means it is a repetition which is thought of here. That is, a medicine can be given in a single dose, and it may be or it may be repeated every 3 hours or 4 hours. It can be given in a weekly dose. It can be given as a fortnightly dose. It can be also thought of given monthly dose also. So our homeopathic dose involves so many important aspects or so many important parameters. Preparations, then quantity and the form of medicine which we are going to administer, and then finally whether we are going to have a divided dose or single dose or repetitive dose. So these all are together put into the concept of the homeopathic dose, or rather homeopathic posology. It is given as a homeopathic posology. Now let's go to various kinds of pose. Before going to the particular subject into it, let's go to various kinds of dosage which is given or described by our masters. So let's take first maximum dose. The term used is maximum dose. It is the maximum or the largest possible quantity of the medicine, not harmful to the human life, which can be taken at a time by an individual. That is the largest quantity of dose which is least harmful to the human life, and that can be taken by an individual at a time. This is the definition of the what's called maximum dose. But in homeopathy, maximum or the large dose should not be administered for the treatment purpose, except in few primary cases where you need to deal with the strong sora or strong that is what strong miasmatic indication, or the strong sora or strong psychosis or a high degree of syphilis. So here the masters, they said you can have a liberty of using the maximum dose formula, or maximum dose can be administered to deal with the high degree of psoric indication or psychotic indication or the syphilitic indication. But here the large dose as well as the repeated dose, in case when there is an indicated remedy is very much indicative, or other way we'll put it, very much similimum is opted, or we are very damn sure that I am going to give 100, 90% to 100% similimum, and then we administer, then the masters say that you are liberty to go for a maximum dose. So otherwise be on a safer limit. That's why. So only this maximum dose concept is advised for using to the dealing with the high degree of miasmatic indications of sora, psychosis, syphilis, or when the indicated remedy is being well chosen and well similimum is chosen by the master or physician, and in that circumstances this maximum dose is being allowed by our organ. Then this is about the maximum dose definition and their applicability in a practical purpose. Then the next dose is known as a lethal dose, or it is also known as a fatal dose. So it is also known as a otherwise it is known as a toxicological dose or narcotic dose also. These are the various terms which is being given by the pharmacy for this dose. There is a lethal dose or a fatal dose or toxicological dose, or otherwise it is finally termed as a narcotic dose. So it is that amount of the dose which can cause which can cause death to the living being. So that dose which can cause the death of an individual, that is known as a lethal dose or a fatal dose. The fatal dose of a different substances may be different. Okay, there is very important point I'm going to give you. The fatal dose of the different substances may be different, which depend upon the toxicity of that particular crude material or the raw material, which you are going to use. So different substances may be of different order, which depend upon the toxicity of that particular raw material or the medicine. A fatal dose of a milder narcotic or a milder poison will be obviously more than the stronger poison. So these are the indication that sometimes the milder narcotics also may be or milder poison may be very fatal than the stronger narcotic and the stronger poison also. So it all depends upon the dose which we are going to use it. So definitely this fatal dose is not advised or not used anywhere, and it is only for a subject of the pharmacy. Only by conceptually we should understand what is fatal dose and what is lethal dose. Then coming to minimal lethal dose, a minimal lethal dose is another pharmaceutical term used. It is the smallest dose that has been recorded as a fatal to the healthy person. That is, this is the smallest quantity which is defined by the pharmaceutical way after proving or after knowing the clinical study or after various confirmations. So that has also been recorded. That is the smallest dose which is being recorded in by the proving that may be fatal to the healthy person. So this is also known as this minimal lethal dose. Then coming to next dose as a booster dose. Nowadays this booster dose is very much, we all know, because during the COVID we all have taken the booster dose. So but from pharmaceutical language, what is booster dose? A booster dose is a dose, subsequent dose given to enhance the action of the initial dose. That is very important. This is the definition of the booster dose. Any subsequent dose which is given to enhance the action of the initial dose. So that is known as booster dose. Normally in our homeopathic way we don't use booster dose, but we can say that suppose we are using 6th potency or the 12th potency, low order potency, and we want to enhance the action of the medicine, and in the next prescription we think that is we have used the similimum and the prognosis is correct and cure is being in the right direction, then definitely I may like to go in a higher potency. From 30 to we can go to 200, or from 200 we can go to even 1000 1M also like that. So whenever I want to enhance the action of the cure fastly, once I know the similimum is being achieved and similimum is chosen and the path of cure is in right direction, then we can afford to give homeopathic booster dosage. So this is just in a general way I told, but there is nothing booster dose which is being explained our homeopathic pharmacy. But from allopathic pharmacopoeia, this booster dose is known as the subsequent dose given to enhance the action of the initial dose. So this is about the booster dose. Then coming to fractional or known as refractive, or otherwise it is known as a divided dose. So this is it is known as a fraction of the full dose which is taken in a short interval. We we choose or we identify what should be the dose to be given. And when that particular dose is divided into fractionally into different doses, then and it is divided into short intervals, then that particular dose is known as fractional dose or divided dose, or otherwise it is in very high technical language, it is known as a refractive dose also. So this is about the fractional dose. Now coming to physiological dose, that is also very important from pharmacy point of view. So physiological dose. Physiological dose is the dose that stimulates the normal physiology or functions of the different organ or systems of the body, and hence the symptoms that appearing in the physiological level is known as physiological symptoms and physiological dose. Administered dose is known as physiological dose. I repeat again, physiological dose are those which stimulates the normal physiology or functions of the different organ or system as a whole in our body. That particular dose is known as physiological dose, and the symptoms on account of administration of this physiological dose, which is exhibited externally, is known as physiological symptoms also. So this is about the physiological dose. Or otherwise, a physiological dose is dose which stimulates the normal physiology or function of the body and which could be administered with safety. This is from homeopathic point of view. A dose that stimulates the normal physiology or function of the body and which could be administered with safety. That's the physiological action of the drug is not a curative. One thing I want to very evidently, all the masters have said, the physiological action of the drug is not a curative action, because we never employ the physiological dose in homeopathy for the curative purpose. We always use curative dose only. We know where we never use physiological dose in our practical purpose. I will give you an example. If you use a physiological dose of a belladonna, then and use the physiological dose of belladonna, it will immediately, it has got a repercussion that it produces a dilation of the pupils, and it produces excessive dryness in the mucous membranes, and it has got a, immediately the flushing of the body will be emanating, and there will be a transgence, there will be turgescences or the swelling of the skins in the body, swelling of the tissues of the body will occur. So whenever the physiological dose of the belladonna is given, then immediately the first degree symptoms, first level of degree symptoms, which is recorded in our Materia Medica, that will immediately will show its repercussions on the physiological level. So I said, whenever the physiological dose is given, that will raise to the, I gave example of belladonna like dilation of pupil, dryness, excessive dryness of the mucous membrane, the flushing of the body, and swelling of the skin also will occur. So never we use the physiological dose, but from the pharmacy point of view, that dose which can provoke or which can alter the physiological functions in the body, that can be taken as a physiological. That dose which can impress upon, or that dose which can that can alter or impress the functions, physiological function, that can be termed as a physiological dose. But physiological dose is never a curative dose. So for our purpose, we are always having a minimal dose, minimum quantity, minimum potency. That is our curative action, curative dose. So this is from the pharmaceutical point, this has been identified as a physiological dose. Then coming to, we'll take one more pathological dose. Another term is used in pharmacy, pathological dose. Pathological dose is that quantity of the medicine which is capable of producing the pathological changes in the tissues of the organism. So that which can alter the that which can bring the organic change in the tissues, that is known as a pathological dose. That is the dose which can bring the biochemical change or biophysical change. That dose which can bring the biophysical change and biochemical change, that is termed as a pathological dose. So then coming to lastly the therapeutic dose. Okay, it is that is what we are interested, and that is what we should know, and that is what we apply in our practical clinical medicine. Therapeutic dose. Therapeutic dose is the least or minimal quantity of the medicine that is required just to bring a change or bring a cure, or rather bring a palliation. This is the definition given for the therapeutic dose. A therapeutic dose is that minimal quantity of the medicine or remedy or medicine which can bring the cure in a person, or bring a recovery in a person, or bring a palliation in a person, particular individual. So this is known as a therapeutic dose. And finally, we'll see the minimal dose or infinitesimal small dose. And minimal dose is that smallest quantity of the medicine required to produce the scarcely perceptible homeopathic activation. This is the apt definition given by the our pharmacopoeia. That's minimal dose or infinitesimal small dose is that smallest possible quantity of the medicine that will produce rarely or scarcely any perceptible homeopathic aggravation. So in a very simplest way, that quantity of medicine which do not produce or which can avert the homeopathic aggravation, that is the minimal quantity of the administrative tablet. So this is known as that dose which cannot cause or which cannot produce homeopathic aggravation, that is known as infinitesimal small dose or minimal dose. Okay, this is the definition of it. And coming to this small quantity or other than very small quantity, we homeopaths are divided into two groups. One group is which is immeasurable in a infinitesimal small group, that is though they remain below the Avogadro number. We all know that Avogadro's number is 6.023 into 10 to the power 23 molecules or the particles. So one group, though they want to remain below this Avogadro number, that they are termed as a dose called infinitesimal dose. And another group is that who go beyond this Avogadro's number, 6.023 into 10 to the power 23 particles or molecules in the dilution in the administrative medicine. So this is about the what's called scientific way of dividing it into two. One group want to administer the drug particles or molecules below the Avogadro number. The other group is that who wants to apply the drug molecules and particles which is above the Avogadro. So this is in terms of pure pharmaceutical way of identifying the minimal dose or the infinitesimal small dose. So with this, we'll conclude about this section, and we will go into next class into extension of this thought. Having known about the different types of dosage in our pharmacy and our pharmacopoeia, we'll go to next class logic and advantage of diluting, logic and advantage of flushing, and dividing into dosing. So these all things will go into next class and know deeper about the posology. Over to Anup and Dr. Murthy.
Thank you, sir. Thank you, sir. Murthy, sir.
Thank you, sir. Thank you. So time is over. Happy Pongal, happy Bogi. సంక్రాంతి శుభాకాంక్షలు. విల్ టేక్ లీవ్ సార్.
Same to you. Same to all. Happy Pongal, happy Bogi, and